Welcome to Meet the Candidates on WCMU. I'm David Nicholas. Our guest is Jodi Decker, the Democratic candidate for Michigan's newly drawn 107th State House District that now includes Emmett, Mackinac, and Chippewa counties, also the city of Sheboygan and the 6 townships within Sheboygan County. Jodi, thank you very much for joining us.
Thank you for having me.
In our first couple of moments, wonder if we could get a little bit of information about you, your hometown, background, and the experience that you bring to this campaign.
I'm in Sault Ste. Marie, way up north. I'm a social worker. I work for UP Kids. I cover 5 counties up here in the UP. My education is in criminal justice. I graduated from Lake State in 2011. And I've had many different jobs throughout my life. I worked for the Sioux Tribe of Chippewa Indians for almost 15 years at the casino here as a vault cashier, vault supervisor. I've worked at Walmart as a cashier while I was going to school. I worked a juvenile justice program for 6 years for teaching family homes. And I've worked inside the Chippewa East Correctional Facility for Trinity, doing the supervising inmates, doing meal preparation and service. And I've been with UP Kids for almost 5 years, doing family preservation.
Very good. And centered in then with life and work in Chippewa County. We mentioned also Emmett and Mackinac portions of Sheboygan. As you've traveled now this newly drawn district, your observation...
It's also Charlevoix.
I'm sorry?
Charlevoix County's in there too.
Charlevoix, okay, excuse me, thank you.
And all the islands.
As you have traveled then, your observation and also what are the voters telling you that they see as the top 1 or 2 issues in this campaign?
Affordable housing, transportation, public transportation is a big one. The abortion issue is also a big issue. So those would be the top 3, I believe.
We've experienced the loss of some 1 million to our population base, and yet so many candidates, including yourself, have talked about the housing and the transportation issues. It seems to be contradictory to areas that would be having less people, but it seems as if we are now coming under these shortages. So what are the local officials telling you or the potential voters telling you? Has the situation changed, circumstances, economic structure, or whatever, due to the pandemic, or are there other factors they see or that you see that have gotten us to these particular issues now?
Well, as a social worker, I deal with people that need housing quite often, and there's always a waiting list. And I don't really think we lost that many people. I think it was more that the census was done during the pandemic and nobody was going door to door. And a lot of people, especially up in the UP, did not get online to do the census. So I think we just weren't counted correctly. But it is what it is now, so. But yeah, we do definitely need housing throughout the entire district. Petoskey's needs it. Charlevoix County needs it. Mackinac County. I know the Sioux Tribe has just, they're trying to broker a deal to make an old, a new homeless shelter for the tribal people here in Sault Ste. Marie. Because there is a lot of displacement, especially now that these programs that the government started during the pandemic are ending and people can't afford the higher rent now. So they're going to be getting displaced.
If we look at roads then, which obviously was a big focus of the last gubernatorial campaign, but the roads, the access to transportation, as you said, things like broadband, internet, these things that especially were amplified and given more attention during the pandemic. How does a district like yours that you hope to represent sit with the conditions of the roads or the availability of transportation, which you've already noted, and then the access to broadband internet, those broad-based, if you will, infrastructure type issues?
We definitely need more broadband in the UP and the northern lower Michigan. There are a lot of rural areas that are just not connected. And we saw that during the pandemic when people had to sit in school parking lots to get on Wi-Fi so their kids could do their work. The main roads have been getting worked on under Whitmer's Fix the Damn Roads, but the roads in towns have not, because that falls on the cities. So that we need to help them with, because some of the roads are just atrocious and people are, the potholes are crazy. But public transportation is something we need to work on because we just don't have enough of it. And people need to be able to get to work. People that can't get a driver's license or lost their driver's license or just are scared to drive or whatever, can't afford a car, whatever it may be, but they still need to get to work and they still need to get to their child care and they need to get their kids to school, and we need to support that.
As we are still coming out of the pandemic, is the economic climate in any of the areas or the district as a whole, how does it sit in terms of what businesses are there, what businesses were lost, efforts to try to encourage the restart or new businesses to come in, and then the overall situation in the schools, making sure that students are trained for perhaps a new look to an economy? What are voters telling you? What do you see within the district you hope to represent?
Okay, I'm going to break that down a little bit. I've already forgot the first part of your question. Okay, the schooling though, I know Cedarville boat building school is expanding. They just did a big ribbon cutting out there, and that is it's through Lake State also, but it's more of a skills-based program. And I know Petoskey, North Central Michigan College, when we were at the forum, they announced that they were doing more skills-based certificate programs for people that didn't want to go through a 4-year program. So that's good. And there are incentives for people going into mental health care, for people going into any public service that are getting free tuition for 2-year college. So I think that's going to help a lot. What was the part about the businesses that you were asking?
Just wondering if how many businesses are still there, how many businesses were lost, and how do people see perhaps a newly shaped economy post-pandemic?
Well, here in the Sioux, I don't think a lot shut down. I mean, the business I was running shut down, but it was there were multiple factors there. It wasn't just the pandemic. But I think bars were hurt a lot. People don't go out like they used to. And so they've had to get creative. But I don't think we really lost a whole lot. And I'm not really sure in like the Petoskey area. It doesn't look like they have a lot of vacancies when I've been down there canvassing and stuff. But I haven't talked to their mayor or their DDA or anything about it yet.
You identified the abortion issue also as something that many voters have talked to you about. Proposal 3, we'll be addressing that on a statewide vote. But if we pull back from that to look at other issues overall of health care, and again, looking at it through the context of COVID-19, the access to health care or lack thereof, health care workers, that overall health care structure, the access to health care across the board, what do you see as what is working well, what needs improvement in terms of this area that you are from and that you hope to represent?
Well, our hospital, I know Petoskey's got a bigger hospital, and it's still an hour-and-a-half drive from where I'm sitting. So our hospital is, it's growing, it's getting better, but it's still limited for specialized medicine. So we still have to travel far to get health care, which is sometimes a problem, especially if there's no transportation available. So those tie in together. But the abortion issue is a healthcare issue. It's not just about abortion. It's about women miscarrying and not being able to get the healthcare that they need because doctors are afraid that they're going to be thrown in jail or charged with a felony. And people need to understand that it's not just the abortion issue that's on Proposal 3. It is healthcare. It is a woman's right to get the healthcare she needs in order to save her own life.
As it stands,
I've had a miscarriage in my life. I've had one, and I had to deliver naturally, and now in some cases that would be investigated for murder in some states, and I don't want that to happen here. And I have a granddaughter and a daughter, and I don't want them to have to grow up with less rights than I did.
as it stands presently, then the specific access to women's health care, if we look at that, even aside from all of the things that involve the abortion question, but as you put it in the broader context of women's health care overall, where do you see then the strengths, or what are your ideas for making sure that that is improved and there is access for women in the district?
Well, even with before Roe was overturned, we didn't really have access in the UP as it was anyway. We still had, I have driven women to clinics, and you have to go down as far as Flint or Detroit to even be seen for that. So it's not something that's widely available anyway. Even to get like at one point you couldn't even get like the Plan B pill here, like because of religious reasons, which that's a whole other story. I don't believe that the church and state should be mixed. I'm Catholic myself, and I just don't think that the church should be in on this issue because they have their own agenda, and it's healthcare. It's women's rights. If you can't choose when you're going to have your family, that's an economic issue also, which a lot of people aren't thinking about. Kids aren't cheap. If you're forcing women to give birth, then you're going to have to come up with money to help them pay for childcare, help them pay for housing, help them pay for all the social services, which the GOP has already said they want to get rid of. They want to cut Social Security. They want to cut Medicare and Medicaid. They think that's a handout. And I'm totally on the opposite side of that.
If we look at then this range of issues that you've addressed and others likely that the voters have talked to you about, if you were going to leave one message with these potential voters as they get set to go to the polls, what would your message to the voters be?
Our democracy is on the line. This is probably the most important vote you're ever going to have. If the GOP gets their way, we may never have another free and fair election again, because they want to. We need to codify our voting rights as well. That's just as important as the abortion issue, I think, because without a free and fair election, we don't have a democracy.
We'd like to certainly thank you for taking the time to talk to the voters that you hope to represent and addressing the issues. Thanks very much for your time. Good luck with the rest of the campaign. Good to have you here.
Thank you.
We've been talking with Jodi Decker, the Democratic candidate for Michigan's 107th House District. I'm David Nicholas for Meet the Candidates. Remember to cast your vote on Tuesday, November 8th. All qualifying candidates were invited to participate in this series. Following the redraw of Michigan House, Michigan Senate, and congressional districts, check with local officials to make sure you are properly registered. Election Day is Tuesday, November 8th.